Good afternoon, everyone. I'm Madeline Milka, President and CEO of APAICS, the Asian Pacific American Institute for Congressional Studies, and welcome to Real Conversations, the Impact of Family Care on AAPI Communities. We are so excited to be working with AARP, and we are thrilled to have them as an event sponsor as we dive deeper into this conversation, something that we know that is extremely important to the AAPI community. And with everything that's been happening with the pandemic, something that we feel is so important to really further discuss and really provide some best practices to help those who might be in need in hearing some insight and expertise. So today we are honored to have joined with us CAPAC Chair and Congresswoman Judy Chu. She currently serves the House Ways and Means Committee as well as the Small Business Committee. And one of the wonderful things that we care most about in her tenure of being a member of Congress is that she is the first Chinese American woman to be elected to Congress in 2009. And we are delighted to have her in giving us some welcoming remarks.
Hello, I'm Congressmember Judy Chu, and as the chair of the Congressional Asian Pacific American Caucus, or what we call CAPAC, I'm so happy to be a part of today's conversation about the importance and value of our family caregivers. I especially want to thank APAICS and the AARP for all your hard work advocating for the AAPI community and our seniors, and for organizing today's event. This has truly been a time unlike any other in our history. The past year and a half of work to contain and defeat the pandemic has shown us just how essential our caregivers are to the fabric of our country. As families have faced increased pressures due to competing family needs, financial stress, and healthcare concerns, we've also seen a dramatic increase in the need for family caregivers. This is especially true for the AAPI community, where caring for loved ones is often an integral part of our cultural identity, and because linguistic and cultural barriers make culturally appropriate care so important. Often, family caregivers are also acting as advocates for their loved ones as they navigate our complicated healthcare system, and caregivers are the ones speaking up for their elderly loved ones. But while caregivers are vital to many families, this need also presents another challenge due to the fact that nearly 8 in 10 of those caring for an adult family member are facing regular out-of-pocket costs. In fact, a recent AARP report found that family caregivers spend, on average, 26% of their income on caregiving expenses. That is why I'm so proud that in one of the first actions Congress took to respond to the COVID-19 crisis, we included expanded paid family and medical leave options so that those who need to stay home from work to care for a sick loved one were more easily able to do so. But these measures were temporary, which is why I am fighting to include a permanent and expanded paid family leave policy in the upcoming infrastructure package. When we talk about infrastructure, we also need to talk about the people who make up the care economy, and that absolutely includes family caregivers. But being essential workers also means that caregivers have been putting themselves at greater risk throughout this pandemic to help provide the care families need. And AAPIs are some of the most impacted, with an incredible 42% of AAPIs acting as family caregivers as compared to 22% of the general population. AAPIs are also more likely to live in multi-generational households, which increases the risk of infection for their loved ones. That is part of the reason AAPIs are experiencing above average infection and mortality rates from this virus. And this trend carries over to the healthcare workers, where Filipino nurses account for nearly 1/3 of COVID-related nurse deaths, although they are just 4% of nurses in the U.S. That's why we need to ensure that both immediate recovery efforts and future economic policies do not leave AAPI caregivers behind. As a member of the Ways and Means Committee, which has jurisdiction over paid leave policies, I am fighting to make sure workers have up to 12 weeks of paid leave to take time off to care for themselves or a loved one. I am also proud to be a co-sponsor of the Better Care, Better Jobs Act that carries forward President Biden's bold vision to expand support for family caregivers. I'm also thrilled President Biden has made infrastructure one of his top priorities and that his proposal includes a significant investment in home and community-based care. Investments into our care infrastructure will create millions of jobs and allow our aging loved ones to stay in their homes while ensuring caregivers, a majority of whom are women of color, have access to the support they need. So thank you again for your work and for joining us today.
Thank you, Congresswoman Chu, for joining us and for all of your continued leadership. Next, we are delighted to have with us Congresswoman Doris Matsui. She is the co-chair of the Congressional Task Force on Aging and Families, where she addresses the full spectrum of issues that affect seniors, from retirement security to long-term care. In 2020, this task force addressed the crisis facing older Americans and their families amid the COVID-19 pandemic. She's also a senior member of the House Energy and Commerce Committee and executive board member of the Congressional Asian Pacific American Caucus, otherwise known as CAPAC. So please welcome Congresswoman Matsui.
Hi, everyone. It's wonderful to join all of you today. I want to thank AARP and APAICS for their continued partnership and work to help address the needs of family caregivers. I'm proud to serve as co-chair of the Task Force on Aging and Families. And each Congress, this task force puts together the Older Americans Bill of Rights, a covenant with seniors that urges Congress to uphold the dignity of older Americans and their families. A core tenet of this resolution is a right to age with dignity and independence. We facilitate this right by investing in mechanisms that allow aging in place. And that work starts with support for our caregivers. I think that throughout our lives, many Americans come to understand and appreciate the foundational role of the family caregiver. Caregiving touches just about every family. There are over 48 million family caregivers of all ages, races, and ethnicities in the United States. As children, we thrive and grow with the support of a parent, a grandparent, or other guardian. And as we age, it's often our adult children who take on more and more responsibility. Caregivers are the bedrocks that help keep us all going. And family caregivers are a pillar of that care economy. They make it possible for their loved ones to live independently in their homes and communities. They sacrifice so that their loved ones can thrive. Yet, the physical, emotional, and financial challenges they face can often be overwhelming. The demands are never ending. Family caregivers provide about $470 billion annually in unpaid care to their loved ones. They sustain significant out-of-pocket expenses, and they need financial relief. A recent AARP report found that family caregivers spend on average 26% of their income on caregiving expenses, or $7,242 annually. In the Asian American and Pacific Islander community, the out-of-pocket cost is slightly higher. AAPI caregivers spend on average $8,368 per year, or 22% of their income, with women experiencing higher financial strain than men. This new family caregiving out-of-pocket study also found nearly 8 in 10 of those caregiving for an adult loved one are facing regular out-of-pocket costs, and almost half of the family caregivers experience at least one financial setback, such as reduced retirement savings, dipping into their personal savings, or cutting back on their own health care spending. Now, over the course of this pandemic, the strain has only been intensified. It has upended the routines of our family caregivers and forced many to choose between family and jobs. It also magnified historic problems in long-term care. highlighted caregiving disparities in both families and the workforce, and made painfully clear how our lack of care infrastructure contributed to our losses in this crisis. One thing is clear, that it is time to rethink and revamp how we care for people as they age and need help with daily tasks. That's why I am proud to co-lead the Better Jobs, Better Care Act, legislation that would invest and expand access to home and community-based services for seniors and people with disabilities, while supporting their home care workers by boosting wages, benefits, and unionizing opportunities. As we continue to have discussions about the future of American infrastructure, we must continue to amplify the message that caregiving is infrastructure, and supporting American families is our opportunity to build a better future. This is about giving seniors and people with disabilities the support they need to live with dignity and independence. We have a real opportunity here to build a better future, and it is long past due we show our caregivers how much we value all that they do. Thank you so much for being here today, and thank you for supporting each other, and thank you for advocating so fiercely on behalf of our family caregivers. Thank you.
Thank you, Congresswoman Matsui, for your leadership. Next, let's get this panel discussion started. It's my pleasure to introduce to you your moderator, Daphne Kwok, who is the Vice President of Diversity, Equity, and Inclusion, Asian American and Pacific Audience Strategy at AARP. She is basically almost like coming home today as the former ED of APAICS. Her work at AARP empowers Asian Americans and Pacific Islanders to choose how they live as they age. She brings to AARP her experience as a leader of leaders through her community service and promoting and empowering the AAPI community. Please join me in welcoming Daphne and our panelists.
Thank you so much, Madeline. And thank you so much for having this opportunity to really talk about, as Congresswoman Matsui just said, how caregivers are the infrastructure. That is really such a true statement. And so we are so pleased that AARP is able to have this conversation with all of you today. There are only 4 kinds of people in this world. Those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. A former First Lady said that quote, and it is Rosalind Carter. It is so true, and I think we all need to remember that we will always, all of us will be a caregiver or will need caregiving, and will be somewhere in this cycle. As was said, caregiving is a infrastructure issue as well within the family. So I just wanted to throw out there, how many of you today provide someone help with like transportation, going to their medical appointments, or going for groceries, or purchasing or organizing medication, monitoring your loved one's medical conditions, or communicating with healthcare professionals, or advocating on their behalf with providers or agencies? If you mentioned, if you happen to say yes to any one of those, if you provide any of those services to any of your loved ones, you actually are a caregiver. And I know for the Asian American, Native Hawaiian, Pacific Islander community, when we ask people, are you a caregiver? Are you a family caregiver? The automatic response is no, absolutely not. Because we believe it's really part of our role, part of our familial role, filial piety. But really, we are caregivers. And it's really important that we also acknowledge that term as well, too, so that we can seek the resources and help that is being provided to caregivers. Today, we have 2 family caregivers who courageously are sharing their personal experience. And I'm so pleased that we have them on today's panel very specifically because not only are they caregivers, but they are also community leaders from our AAPI community, staff members of some of the leading AAPI organizations in the country. So it's a little different perspective that they are able to share with us today, not only their personal, but then also what is it like to be working in an AAPI organization that is serving our AAPI elders. So at this time, let me introduce our guests. we have An Thuy Duong, and she's a Vietnamese counselor with the National Asian Pacific American Center on Aging, NAPCA, in Seattle. And she's with their helpline program. Her parents came from Vietnam to live with her family in Seattle in 2019. Unfortunately, as we all know, the pandemic hit in early 2020. Her father got sick during that time, and he unfortunately refused to go visit doctors because he feared COVID-19. He was later diagnosed with both lymphoma and lung cancer at a very late stage. And unfortunately, he recently passed end of last year. And Anne quit her job to become her father's caregiver during that time period. We also have Mike Murase, who is with Little Tokyo Service Center in Los Angeles. He's been a nonprofit administrator there for a number of years, and I've had a chance to work with him over all these years as well. And he's played leadership roles on the social service side of it, and also building the community recreation facility in Little Tokyo, which just opened. He and his sister were family caregivers for their late mother, who passed away in 2018. So at this time, I'm going to open it up to our speakers. We're going to have a conversation. I'm going to ask some questions and answers and have them answer it. But then I also want to, at the end of this, throw it out to all of you that are participating. And so on Facebook, we'd love to have you be able to participate in the comment section, so that we can grab your questions. And if you are on the Zoom, to put your questions in the Q&A so we can also grab your questions. We very much want to hear from you and be able to have our experts be able to respond to you as well too. So my first question, I'm going to throw it out, and we'll have Anne maybe perhaps respond first, ladies first, to maybe share a little bit about your caregiving journey.
Hello, everyone. I began to be a volunteer caregiver for senior in my community in 2015. At first, I helped new immigrants with interpretation, social security, medical insurance, and doctor visit. The senior neighbors in my community are from Bangladesh, China, India, Korea, and Vietnam. And then I have my parents when they come to the US in 2019. Unfortunately, the pandemic arrived and my father got sick. So I have to quit my job and became my father caregiver at the hospital, and he passed away. So after that, I joined APTA shortly after my father passed away, and I have more senior around the country now.
Okay, is that okay? Thank you so much, and thank you so much. And that's really fantastic that now you're taking your personal experience, caregiving journey to help and share it with others. We'll turn to Mike now to have him share. And I just wanted to ask and throw out the question to everyone to think about, what percentage of caregivers do you think are male? What percentage of caregivers do you think are male? And after Mike speaks, I'll give you the answer to that question. But Mike, would you like to share your story?
Well, first of all, thank you very much. And I think the two Congresswomen and Daphne summarized the issue very well. And so I just add a little bit of my personal story. And first off, I know the answer to Daphne's question, but I won't say it now, but I am in the minority as a man. I know that most caregivers, family caregivers, are women. And that was the case with my sister and myself. My older sister was already retired at the time, so she became the primary caregiver. But while I was working, I tried to do what I could to take my mother to various medical appointments, to grocery shopping once or twice a week, and do all of the things that I would do, not so much as a caregiver, but as a son, and my sister as a daughter. And that's, I think, the way I viewed it. I think one of the things that I like to say is that, you know, it is a labor of love. And so we don't think of monetizing anything. We don't think about costs. We do what we can to support, you know, my mother. And I guess I don't know if I'm jumping ahead, but I feel like as Asian Americans, we do have, you know, particular various, like my parents were immigrants, so like language issues and cultural issues that we have to address. And one of those cultural things is our reluctance to seek outside help, and reluctance to look for public resources. And often, even if we look, they want the resources available in language. So I think so those are some of the, I think, particularities of being an Asian Pacific Islander caregiver. I'll stop there for now.
Okay, so Mike mentioned, he thinks he knows the percentage. Yes, males are in the minority, but I think that people would be surprised with the answer of what percentage of caregivers are male. It's actually 40%. So it's almost on parity with women. And I think, as most people would expect, they would probably think it's more female than male, but 40% is a very large number. I'll also throw out another number that is of interest too, is that millennials, what percentage of caregivers do you think are millennials? And actually it's 25%. That is a very large number. And we don't particularly think of caregivers as young people, but they are as well too. I think that what Mike mentioned is that when we talk about caregiving and family caregiving, we don't think even about the financial aspects of what it really costs. But as Congresswoman Matsui mentioned, the statistics of how much out-of-pocket cost it is for AAPI caregivers, it actually does add up, you know, almost $8,000, $9,000 per year. And so that's one, the hard dollar costs. But as Anne mentioned too, it also, another consequence of caregiving too means also perhaps stepping out of your job. And so Anne, I was wondering if you want to maybe talk about your decision to step away from working during that time of your father, and then coming back into the workforce.
I got two jobs before my father got sick. I got two jobs as a before and after school teacher at YMCA and substitute para-educator at school district. But I had to quit both jobs when my father got sick. It means 6 months of unemployment. Besides, I had to hire a babysitter for my kids when I took care of my father at the hospital, and my husband on a financial burden come with my husband, so that's why he could not take care of my children. So that's why I have to hire a babysitter. So the unemployment of 6 months and the cost of babysitter, so I think it's a kind of difficult for our family at that time.
Thank you so much for sharing that. I just want to say that, so one of the pieces of legislation that AARP is actually working on, and which my colleague right now is on as well too from Government Affairs, Beverly Gilliard, will really help family caregivers. And so one of the legislative priorities for AARP right now is a Credit for Caring Act, S1670 HR 3321. It's sponsored by Senators Ernest, Bennett, Capito, and Warren, and by Representative Sanchez. The bill creates a new non-refundable federal tax credit of up to $5,000 that would help eligible caregivers who work, including military veteran caregivers, address the financial strains caused by caregiving. Eligible family caregivers who work and care for loved ones of all ages could receive the credit if the person they care for needs a certain level of care. This tax credit also would help those who care for non-dependents or who do not live with the person they are assisting. So we hope that this piece of legislation passes and encourage people to contact their members of Congress to urge for the passage of this bill, which would help our AAPI family caregivers. So one of the things I mentioned in our pre-conversation with the speakers is that why it's so important for us to help inform and educate and stress that for those of us that are really in the caregiving role, that we understand that we are caregivers, so that hopefully when this bill passes, that should we be fortunate to be in a position to take advantage of this tax credit, that we could be receiving $5,000 a year to assist. Some of your thoughts, either Anne or Mike, about getting our community to understand that we are caregivers and using that terminology.
Yeah, I think it's very important for all of us to name what we are. We don't stop being sons or family members, but we add on another role when we become caregivers, and we should make sure that identity is clear, so that we seek the kind of support and the resources that we need as caregivers. Like Daphne mentioned, I worked in an organization that deals with social services for many years, but our organization provided a lot of information to clients about caregiving, but I never thought of me making use of that personally, because I think there are a number of reasons, but I think it's kind of partly human nature not to really focus on what you need to do day to day as a caregiver until you need to do it. And I think preparation, at least, and getting the knowledge beforehand is very important.
Mike, I think what you said. So right here we are, three of us on the panel right now, where we're working for organizations that are addressing caregiving, have resources available. And I have to say, since I've been with AARP, I've been out there in the community talking about how important it is to talk about preparing to care. We have a booklet called Prepare to Care that we've actually translated in Chinese, but also a version for the Asian American community. And, actually recently, I'm very fortunate, my dad is 95 years old, was doing really, really well until about 2 months ago he fell. And I just went back to that Prepare to Care booklet to go through there to see if I personally am following all the steps that we've been putting out there as well too. So I think it is, we're in this very important position and role within the community and within our own professional lives as well too. Wanted to throw it out there to you also, both of you, is so how do we manage and keep the professional and personal boundaries? Should we try to meld it more? Do we try to keep them more separate when it comes to our own personal caregiving experiences? Any thoughts around that?
Well, I think for me, I had to wrestle with keeping the boundaries at work, because I didn't, I oversaw a lot of the work, and I didn't want to impose on my staff. So I, occasionally I asked for help, but for the most part, I had to navigate everything pretty much on my own, or rely on the things that I had learned prior to my mother becoming ill. So it's a fine boundary, but I think the other part of it though is that, having discussions like this and advocating in the mainstream community about the needs of the entire community is important, because I feel like, there's, we're seeing the history of racism in this country. It's gone up and down, and but I think there's a history of Asian Pacific Islanders and immigrants being sort of otherized, or like permanently thought of as foreigners. And I think that has an impact on us, because I think API community is probably the most reluctant to seek public resources when they're available and we're entitled to them. And I think that's something outside of my own work, but going out to the other agencies, I think is in navigating that complicated healthcare system that Judy Chu talked about. I think that's very important.
Absolutely.
Yeah.
And what are you in your community, in the group that you are networked with? What are some of the issues and concerns that you're hearing from your community when it comes to the caregiving issues?
It's not actually issues, but when I work for NAPCA, so I get more resources, more information, and so that's better served for for the senior in my community. I think that's a good a kind of bonus when I work for a senior center.
What are some of the more of the questions that they ask you about, or what is the most popular materials or resources that you give back out into the community? What are they asking for?
I think there are two questions. There are two most common questions. One about how to get vaccine, and another one about Medicare and Medicaid. Yeah.
Okay, so that's why one thing, and more information. We've also heard that too. The more information about Medicare, Medi-Cal, so that would be very, very good. Mike, what are some of the, for your Little Tokyo Service Center is tremendous foundation in the LA community. What are some of the main issues that you guys are helping the community address?
Well, when LTSC began 40 years ago, the first main program was senior services. And so we've been dealing with caregiving issues for 40 years. And over the years, we've done many community workshops where we have hundreds of people attend, and we do it in language. So we do Japanese, Korean, and English. I think, so despite what I said earlier about not focusing until we need it, we want people to be prepared and have at least the basic knowledge about what caregiving issue is and what the challenges might be. We also have a registry to match caregivers and care people who need care, because I think it's often difficult to find people for culturally sensitive in language caregivers. And so it's a modest program, but what we do is we match Japanese speaking potential caregivers to people who need caregiving. And that's worked out well. Another thing we do is have support groups for caregivers. And some of them are specific to Alzheimer's or cancer or some other, chronic illness. But I think in addition to not seeking resources, I think API's many cultures don't like to talk about issues that are personal to them or that are challenges to them. And I think having a support group of people who understand the experiences, I think has been a very good way of sustaining the caregivers because so much of their focus is on the other person. So those are some things that we've done that I think have been very helpful to people.
When I started to work for AARP, I was thinking to myself, oh my goodness, I'm going to an organization that is addressing issues that the AAPI community does not want to talk about. They're all taboo issues, right? Health, finances, money, aging, end of life issues. But how critical it is for us to be able to raise these issues. And I think, Mike, what you said about how our community is so reluctant to talk about these, it's also often really surprised me that the need and the hunger in our community, they actually really do want to talk about caregiving and how they can support one another and share each other as well too. So when we hold, and when we were holding them in person, events, it was amazing. We could have held those sessions for hours and hours and hours. And I was so pleasantly surprised to see that Asian Americans in a public setting where they don't know others would actually speak up and share. And I think that was just so healthy. And I hope that, whether now we do it virtually or we, hopefully soon we can go back to in person as well, that we'll be able to continue that conversation and really normalize all of these topics, right? When it comes to, aging, end of life, caring, health issues, finances, and no matter what age, right? We shouldn't be talking about these just when we're older in life, but also younger as well too. Great. Wanted to see if there might be some questions that are coming up. Want to remind people that to please submit them in the comment or the Q&A section, and APAICS staff will let us know as well too. So here's a question that has come in from Facebook. As Daphne said, you all are fortunate enough to be working in the caregiving space as you were on your own caregiving journeys. Of course, the AARP resources out there, as Daphne mentions, but what advice do you have for someone who's about to embark on this journey but has no experience or feels overwhelmed? What would you say to them to help them on their journey in terms of what they can expect or what they can do, feel, or learn? Anyone want to respond to that? What recommendations would you have to someone who's just starting on their caregiving journey?
Well, I would say, again, learn as much as you can, and also be open to seeking help, and don't be ashamed of asking for help. I think you get into the mode of helping someone else, but often forget that you need help too. And then I think in my case, I also want to point out that, we had, my sister and I did it together. And I think it's very important to work out expectations and rules and ideas about how we want to do the caregiving as a family, and not because, sometimes we hear from our clients that one brother thinks one way, a sister thinks another way, and someone else thinks some other way, and often adds to the conflict and the stress of caregiving to have not to be able to be in accord with each other. And I think the caregiving experience itself is already an emotional journey, and I think you want to avoid the distractions of having to, navigate all kinds of other relationship issues, and so I think it's good to have that understanding in the beginning.
And do you have some suggestions for this individual?
I absolutely agree with Mike. Yeah, it's we should try to learn and find as much as resources as possible.
I would encourage people to actually go to the aarp.org/caregiving. There's a lot of very, very good resources there. Also, if you go to aarp.org/AAPI, we actually have a few short little videos, they're only about 10, 11, 12 minutes, but one is 3 Filipino Americans, including General Tony Taguba, talking about his caregiving journey. And we have one with 3 Chinese Americans that also includes Richard Louis, the MSNBC anchor, who shares his caregiving journey. And within each of these videos, it's a little snippet onto the various issues, whether you may be in that sandwich generation or you may be caregiving long distance, what it's like. But these are some catalysts and thought starters for people to watch, and those videos are all on those AARP websites. And we would encourage you to watch them so you can start to hear what some of the issues are. And I think what Mike said, which is so, so important, right, is for caregivers that you must take care of yourself. Because if you don't take care of yourself, you won't be able to take care of your loved ones. And so how important it is to really care for yourself. And for those of us that are around those primary caregivers, how important it is for us to support them as well. Okay, let's see. I think there's another question here. A question from Cynthia. Will the new bill introduced address these scenarios, or is the 5,000 tax credit only available to one caregiver? Many siblings share these responsibilities. I'm wondering if my colleague, Beverly Gillard, if you're on, if you might be able to respond to this question, if Beverly is on.
Daphne, I think she jumped off.
Oh, we just lost her. Okay, Cynthia, let us get back to you on that specific question with the piece of legislation, so we can let you know. As you said, right, many siblings share in that caregiving. So who does that tax credit, will it be provided to? Other comments or questions? Maybe Anne, especially because you and your experience occurred during this time of COVID, how difficult, more difficult the situation is when everything is locked down as well too. Maybe can you talk a little bit about what differences there might have been for you when you cared for your father?
I feel I'm still lucky that I could be with my father at the hospital until when he passed away in October. So after that, all of the family caregiver, they could not be at the hospital with their family members. And I think this is the most the saddest part, when the family caregiver could not be with our family members at that time during the pandemic. Although that is hard for us to be with our family members at the hospital, so I have to arrange my children and my job at home, so prepare food because my father didn't like American food. So he prepared some Vietnamese food, and I have to prepare food for my husband, my children, my father, and myself. But I feel I was lucky that I could stay with him until the last minutes of his life. And after that, some of the caregivers I know, when we met at the hospital, and they said that all of them could not be at the hospital anymore from November. So that's a kind of what caregivers have to deal with during the pandemic.
I think, and I know that for our community, right, mental health is also another taboo topic. And yet I think, especially during this time of COVID, not only just the COVID, but also the anti-Asian hate compounded on all of this. I think that for our community, we really need to take care of one another and ourselves with the mental health and the stresses as well too. And I think that for many of your groups as well too, being able to provide the mental health assistance is so key and critical. And I hope our community continues to open up around the need to take care of ourselves as well. We have a question here as well from Sachin. How can I convince a parent to be open to another person helping? We have an endangered language and she's religious. She is a very private person too. Any thoughts about that? How to convince a parent to be open to another person helping? I know someone that's also very private as well too. Any thoughts? Well, maybe I'll share right now. You know, as I mentioned, my father is actually had a fall recently, and so I'm fortunate I do live with my parents. And so my mother, who's 88 years old, thank goodness she's still very strong, very independent, but she thinks that she can do it all. And and I'm here, we're able to work from home right now. But it has been tough to ask her to sort of let go, to let me help her, because she thinks that she can do it all. And it's so one of the things that Mike was saying, right? How important it is for that caregiver to take care of themselves, is the line that I keep using with my mother. It's like, you really need to take care of yourself if you really want to take care of my dad, right? Because if she's not, if she's physically exhausted, mentally, emotionally exhausted, there's no way that she can adequately care for my dad as well too. So that's my thoughts. Any other thoughts on that question?
I think that's, what Sachin asks is a very good question, and it's almost universal. It comes up in the early stages of the caregiving relationship, but I don't know if I would say convinced, but I think, try to have conversations with your parents about what the journey ahead might be. And, I think you want the person to be flexible, but still at an old age, I think can't expect like dramatic changes if the person is private, religious, speaks a different kind of language, whatever. So I think it's not good advice, but all I can say is just do the best you can, and keep in mind the sort of the overall context for you and your parents.
And any thoughts there to share?
Actually, I don't, because I cannot convince my father when to visit doctor during the pandemic. So that's why actually I'm not good at convincing senior. Even I could not convince my father.
It's tough. It's really tough, but I think we really have to try. We really do have to try. Another question here. What kind of support have you found most helpful from your friends, your employers? Do you find it hard to talk about your caregiving role with others? What kind of help has been most helpful from your friends and your employers?
I want Anne to speak up, but I see she's muted, so I'll say something. At LTSC, I was fortunate to have a very flexible and understanding organization, employer. So I didn't necessarily take advantage of them, but I felt like people understood that I was in a caregiving situation. At the same time, I didn't share a lot of details, and so whenever I had to leave at a moment's notice or something, I just said I had to leave, and that was it. And people kind of assumed that I had to take care of something personal. But for people who don't have that kind of employer understanding, I think it's more difficult. But again, you have to do what you have to do, and whether you rely on vacations or sick leave or whatever policies your employer allows, I think I think caregiving does become a priority for a period of time. So,
Anne, anything to add there?
Sorry, I don't. I agree with Mike, and it was a tough situation for me.
I would say that I would really encourage people to really, if they're able to really seek out, especially those caregivers that have cared for other, or have already cared for someone, because more often than not, they are more than willing to share what they've learned with others as well too, and that support is extremely important. I would say for those that are working in organizations or institutions or corporations, especially larger ones, that hopefully there might be a caregiving network or group within your workplace. That is extremely helpful because there you can go and seek help and support from others. And if there isn't, perhaps if you're interested in starting a caregiving support group within your workplace, let us know, let AARP know, we can help you too, because we had one that just started up a few years ago as well. There's a question here from Suda. What federal legislation beyond tax credit and paid leave for caregivers is AARP advocating for? We have been advocating for the CARE Act, which actually was passed in several states and it's happening throughout more states at that state level, is really to be able to give caregivers rights for their loved ones once their loved ones leave the hospital. So that is a piece of legislation our team has been working on for a number of years at that state level. And there's so many more issues that AARP is advocating for on the caregiving, whether it's at the federal or the state level. I'd encourage you to go to our aarp.org website to learn more. I'll say one of the main issues that we will be picking up once again, we're doing a lot on COVID, but one of the issues that we continue to address is really on prescription drugs. The importance of trying to get legislation passed that really keeps down the cost of prescription drugs, which really impacts everybody as well too. So that is one of the other major campaigns as well. I know that there is another question that is being asked right now. There was one on a millennial. As a millennial caregiver to my father, I'm concerned about the financial cost for him in the future. He's currently healthy, but it's hard to predict what will happen in the future. How do you navigate this piece, especially with having insurance cover costs? What resource have you utilized that helped you with costs or with educating yourself on gathering resources? I'll just throw out there that actually AARP does have a caregiving financial workbook, which we have out and was just translated in Chinese. We're also going to be translating into Korean and Vietnamese as well too. So this financial workbook for caregivers would be a great way and opportunity to help you plan out financially. I don't know, Mike and Ann, if you had any thoughts about that.
Well, the only thing I could say is that healthcare system and the caregiver support system in this country sucks, the financial aspect of it is a big part of it. I think when people can afford it at the time that they can afford it, and some people get long-term care insurance, but that's privately paid for. Medicare doesn't pay for many of the caregiver costs. So I think often people who are not wealthy have additional burdens, and people who are above the Medi-Cal line in terms of income, but still not wealthy. I think they are the bulk of the API community, and it's very difficult to figure out, a lot of the healthcare costs are sort of like gambling. It's like long-term care, you may have it and not use it. On the other hand, should you invest in it? All these are decisions that are very personal, or, depends on the family situation. So I don't, unfortunately, I don't have a very good answer for you, Lee. I would say rely on AARP, rely on LTSC and NAPCA and other organizations to learn more, because I think in the end, your own knowledge about all these things is what's going to help you make those decisions about what choices you make.
We're going to unfortunately have to end our tremendous conversation today. Hopefully it's just a starter for all of you right now. But I do want to reiterate what Mike said. I hope that you'll utilize our organizations as resources, Little Tokyo Service Center, the National Asian Pacific Center on Aging, as well as AARP. And we can help you steer you to resources or to other organizations as well. So really thank you to Anne and to Mike for your tremendous work that you're doing for community and for sharing your personal story as well. Thank you, Madeline, and to the APAICS team for having us today, and I'll turn it back to Madeline.
Thanks so much, Daphne, and to Anne and to Mike for all of your insightful words and advice. I think a lot of our community is really looking for ways to which we can find these resources. And so we look forward to putting this recording up. This will be, people can share the link for this recording for those who are not able to watch it live on the APAICS Facebook and YouTube page. And so hopefully some of this will be useful to people as they start to navigate this situation. And obviously we are very glad that we were able to help distribute some of this information, and having NAPCA and Little Tokyo Service Center and AARP as a part of this conversation, I think is only just going to provide more information to our community. So thank you so much for joining us today. Thank you to AARP for being such a wonderful event partner, and we look forward to seeing all of you the next time. Take care, everyone.